Bismillahirrahmanirrahim, Dr. Mohibullah Wazir. The topic is the lesions of the brachial plexus. The brachial plexus, it is related over here to the posterior triangle of the neck and then to the clavicle and then in the axilla. That's why any injury or any blow or any gunshot or any stab wound or any compression on these areas or in these areas, for example, compression due to crutches, etc. Okay, or the compression due to dislocation of the shoulder joint, or during delivery of the baby, over traction over delivery of the baby, or in breech delivery. Anyhow, all these reasons can lead to damage the brachial plexus. Now, what are the different damages or injuries of the brachial plexus? The first is which we call it as Erb's palsy, or also called as Duchenne's paralysis. This is the condition in which the upper trunk, C5, C6, the upper trunk is damaged. And in this condition, the upper trunk is damaged. What happens that the limb is paralyzed in such a way, note the point, that it is hanging by the side like this with pronated position. It is medially rotated, it is pronated, and what you do, the limbs remain extended and then medially rotated and pronated and hanging by the side like this. And also you can see this condition. This is also called as batter's tip hand or policeman tip hand. And in this condition, what movements are lost? Number one, loss of abduction. And number two, loss of supination. And loss of lateral rotation. And loss of flexion. And because of this reason, the limb remains extended, medially rotated, and pronated in all the times. And the patient cannot raise the hand, the upper limb by the side. This is Erb's palsy or Duchenne's palsy or policeman's tip palsy or batter's tip palsy. Second one is the clump keys paralysis. Clump keys paralysis. In this clump keys paralysis, the damage is to the lower part of the brachial plexus, that is usually to the C8 and T1, either to the roots or to the lower trunk. And the C8 and T1, it supplies usually the hand and the ulnar side of the forearm. That's why it will result into condition of the claw hand of the ulnar palsy, the claw hand of the ulnar palsy, as well as sensation of the ulnar nerve which is supplied, and the small muscles of the hand which are supplied by the ulnar nerve. These muscles all will be paralyzed. And secondly, because the sympathetic fibers to the head and neck or to the brain process from the T1, that's why if there is damage at the T1 level, maybe it results in the Horner syndrome as well, in which there is ptosis and anhidrosis of the eye, etc. Horner syndrome we study separately, but Horner syndrome can also occur, and claw hand of the ulnar palsy and cessation over the ulnar nerve distribution area. And then the third one is the crutch paralysis, or also called as Saturday night paralysis. This crutch, it is when the patient is wearing crutches in both or in one axilla because of continuous pressure over here into the axilla. Because of the crutches, the axillary nerve is damaged. Or in our European brothers, at the Saturday night when they are overdrunk, they sleep in the chair and the arm is hanging by the side at the chair and the axillary damage. Then what happens? The abduction movement of the arm is being affected. There is no abduction and the arm is hanging by the side, hanging limb. And then one another the paralysis that is called as winging scapula. Winging scapula, the long the long thoracic nerve or nerve to the serratus anterior, which is from the C5, 6, and 7 roots which supply the serratus anterior muscle. Serratus anterior muscle is involved in rotation of the scapula, and when you are lifting the arm up, for example, for ringing the bell, or sometimes you are having sketched something, and that time the scapula being rotated and the glide cavity faces upward. That is because for it is anterior. If the long thoracic nerve is damaged, what happens then? The Bell's nerve or Bell's nerve that is being damaged, that is long thoracic nerve, then results into drop of the scapula, or which you see that is the winging scapula, like this. In this way, there is earth palsy, Klumpke's palsy, and then winging scapula, and then Sachs-Lenard palsy, or also called as the crutch paralysis. These are the lesions of the brachial plexus. And then the individual nerves, for example, the musculocutaneous nerve, and then the damage of the median nerve and the ulnar nerve and the radial nerve, that I have already discussed in relation with the discussion of the median, ulnar, and radial nerve in detail also. Thank you very much.